So welcome everyone to our first somatic movement experience. We have no idea how this is going to evolve. Well, I don't anyway, you might, but I don't. We are going to do a bit of a review about pain and the nervous system and what somatic movement is. And then we're going to have a little bit of fun experimenting with somatic movement, which you can join me for if you wish. And after that, we're just going to open the floor and have a chat. So bringing experience and client questions and things like that up. We'll do our best to move through that however that happens. So first of all, what I'd like to do is just refer to some notes that I made just very generally about somatics and what that is. They are exercises developed to reduce the tension in our bodies through something called pendiculation. So if you think about a movement of a cat or a dog, and if I actually woke my cat up from the sofa here, she'd probably do it. But you think about that movement that they do where they actually, drop back into that kind of child's pose sort of thing, and then they arch their back, and sometimes they might stick out a paw or two and just do a full body stretch in transition from lying down to walking around. And the idea behind somatics is that we do need to regularly reduce the tension that builds in our body from being in positions for too long. So we need to do this pandiculation ourselves, except we don't, because we're sitting and staring at screens all day. So the pandiculation allows us to reset our nervous system. It enables us to access primitive and innate motor patterns that may have gotten a little dusty, a little overwritten. And again, with our sedentary lifestyle, we forget to hit the reset and go back to those primary patterns again. Instead, we end up adopting new patterns and new postural habits, which then become our normal. Without us realizing it, this creeps up and over time sort of takes over our general behavior. So when we try to move from these new habitual patterns, well, I didn't catch you, did you do it? When we try to move from these new positions and postures, we have pain. So there we go, pandiculation, yay, thank you. So we need to be able to do this pandiculation and also work on the underlying postural changes that could occur unless we do that pandiculation very regularly. So as we try and move and strain against the habitual postures that have become our new normal, that's when the body starts to perceive discomfort and pain. So the cycle of restricted movement and tissue restructuring leads to even more limited movement and therefore more possible discomfort and pain. And we just keep going around and around in that loop. So now it feels really risky to challenge these postures that have become our new normal. And we start to notice that the physical adaptations lead into maybe some emotional results of hesitancy, balance issues, feeling of being unsafe and unstable. And so we're no longer moving with confidence through a comfortable and full range of motion. And we are no longer even going back to healthy movement patterns and loading them and over time increasing tissue tolerances and capacities. We're working within a restricted tissue tolerance, a much lower capacity, and therefore we have a body that's almost like in a new cage. And it's very, very challenging to reemerge from that unless we do it very, very gently and extremely mindfully. So pain is our body's high alert system. And as we spend more and more time in these new habitual postures and the movements are restricted, the tissues shorten, we don't need all the length and the mobility that we may have enjoyed before. So again, everything shortens and tightens just a little bit more, and we get additional restriction. When you couple that with being dehydrated, a lot of us are also a little bit malnourished and a little bit sleep deprived, the nervous system really takes a hit. So when the nervous system feels threatened by these new limits to our capacity, this is where we have pain. We obviously don't like feeling threatened. We get warnings now earlier and earlier and earlier that we're about to hit this pain threshold, this new threshold of limited movement. And so we stop trying anything that our body might perceive to be unsafe, foolish, or cause some imbalances to our general system. It's now the body's protective mechanism that's kind of hit 11. It's this new gear that we exist in all the time, but it's functionally causing us massive limitations and balance challenges. So the idea behind somatic movement is that we are encouraged to pay extremely close attention to how our body feels, and we're enabling the body to move more freely with a lot of conscious awareness. So this less restricted movement means that we have this lower threshold now for activation of the sympathetic nervous system, and we need to move into a greater activation of the parasympathetic system. And that has to be done with a lot of patience, gentleness, and understanding. So, any questions about all of that before we try a little bit of movement? Anything come up there for anybody? No, that concept of restricted movement leading to discomfort, which leads to more restricted movement, sort of makes sense, right? We're pretty familiar with that. Okay, so as we move into the movement phase here, I'm just going to be looking at my cheat book called Somatics and walking you through a few different patterns that I've selected that are pretty gentle. They should be pretty interesting, but not threatening for your clients. So if you deem these to be reasonable, you may want to give these a try for your clients. For you yourself, if you're trying this with me tonight, just be careful. They might be new movements for you. And so take your time with them, and you may want to do them at half speed even. You may want to sit one out and just observe. I'll leave that up to you. So first thing I'd like to do is just talk a little bit in a standing position about what Thomas Hanna refers to as the red light and the green light. So he talks about two different reflexes, the red light reflex and the green light reflex. So if you bring yourself up to standing, if you like, you can try this with me. From there, we're going to do a little bit of a standing movement orientation and then a little bit of meditation before we come down to the floor. So I'm just going to shift my camera so you can see my cat and me, the full body here. All right, whoops, cut off at the head here. Okay, so first thing to think about is, let's say we're going to talk about the red light reflex first of all. And so what Thomas Hanna refers to as the red light reflex is a position, if you think about someone who is fearful and you think about someone who feels pretty unsteady, and the fear may be physical of movement and confidence about being able to move their body in space, but it also could be emotional. So keeping in mind, as I'm sure we're all aware, that we could have physical pain, we could also have emotional pain. It's very, very difficult for the body to tell the difference, which is pretty interesting. So when we're in this very protective, what Hanna refers to as the red light reflex, if you try that with me, it means kind of a sinking of the rib cage. It means a flattening of the lower back and a posterior pelvic tilt here. And so you can see how the ankles bend and the knee bend, and you get into a little bit of a full body flexed position here. So it's a little bit head forward, head drops down a little bit, everything curls in. And of course, to balance, our arms come forward and perhaps internally rotate a little bit. So this is one pattern, maybe not this pronounced, of course, but one pattern you might notice with your clients. Another one might be the opposite, the green light reflex. So the green light reflex, as you can imagine, the opposite would be a very lifted chest. It would be an extended neck. It would be thoracic extension as well. it would be a huge amount of activity of the paraspinal muscles here, an anterior pelvic tilt, extended knees or hyperextended knees, and a weight shift forward. So there's that green light. And so if you think about this as being like a big armored shield on the front of the chest. And so both of these reflexes are defensive, right? So if you come back to what you picture as your comfort level, and I'm assuming that it's somewhere in between, you can appreciate that you might see both patterns, or one pattern or the other, I should say, in your client. So recognizing that in your postural screen right off the top of an assessment or the beginning of a client session might be very important for you to become a little more familiar with what your client's managing that day. Any questions about the very simplified introduction or review of the red light and the green light reflexes? Everyone's all right there? Anything to add? So the next thing I'd like to talk about is if we move into a standing comfortable posture and legs about hip width apart and just relaxing here. And you can close your eyes if you wish. And what I'd like to do here is just have you moving from one side to the other very gently. So just thinking about what we always joke in our circle as a drunken sailor. So just going foot to foot. And I know Sarah had a different way of putting this that was much more eloquent than a drunken sailor, and I've forgotten your term.
TikToks.
TikTok,
like a
thank you. TikTok like a talk.
Yes.
Very good. Okay, I like that better than a drunken sailor, so thank you. The TikTok, okay. So gently move your body in this TikTok motion, but as with all somatic movements, it is very slow. I will encourage you to bring your body weight between your forefoot and your heel. So you're kind of in midfoot. And I want you to not ignore, but really think through or feel through the middle of that movement. So it's a very subtle weight shift from side to side. And thinking about, can you fully bear weight on each leg? Okay. And then from here, stopping yourself somewhere around the middle, can you shift forward? And we're not talking like a ski jumper sort of thing, but just a little bit of body sway forward and backward. And you can close your eyes here to feel the body shift in toward your toes, shift back through midfoot and into heel. And then coming to rest somewhere in the center of all of that. And then a slight circle in one direction, very tiny. Slower is better. Paying close attention to what happens to muscles in the feet, shin and calves, and quads and hammies, and glutes probably as well. And then go ahead and take that in the other direction. And keep it small because you want very tiny reactions from the body, not big, big reactions, because that could be perceived as quite threatening. So in this position now, if you keep your eyes closed and you bring an awareness to your toes, so you lean forward so you can feel a slight pressure through your toes and your weight is just a little lifted away from the heel. And then traveling up your body, can you relax your thigh muscles? Maybe that means you allow your knees to soften a little. And then can you let your pelvic floor relax? And then can you let your belly go? We're all friends here. Let's see your Buddha bellies. And then just relax your rib cage. kind of away from that green light posture a little bit. And then can you let the weight of your arms just hang from your shoulder joints? Maybe have a light wiggle of your fingers. And then can you gently come tall through the top of your head, but stay away from that green light reflex? And traveling up a little further, just making sure your mouth is closed. And just rest your tongue on the roof of your mouth. And relax your teeth so they're not together. Relax your jaw. Let the muscles of your face soften, so around your ears and your eyes. And then maybe think about letting your scalp muscles go as well. They can be quite tight. And maybe tuck your chin slightly in case your neck's a little uncomfortable. And then from this position here, very, very gently, can you explore where your body weight is? Did it stay in about the middle position, or do you have to just slightly nudge it back to where it needs to be? Just to finish the standing meditation, if you come down to the feet, you can do a slight toe wiggle again. Adjust your weight balance across your foot. You may need to come back to bending your knees slightly, so you may have returned to quite a straight knee. Just let your shin and calves relax, quads, hammies, let your bum muscles go. Pelvic floor again. Did your belly tighten? Did you start holding your breath without realizing it? And just feeling your rib cage move softly as you breathe in and out through your nose. And traveling up a little further, what's happening with your breath? Are you able to relax your breath in your body? Is your in breath about the same length as your out breath? And is your breath fairly light, soft, shallow? And then just bringing yourself into a little bit of appendiculation, whatever that looks like for you. And we'll move down to the floor if you're comfortable there. Otherwise, you could move to a bed or even a chair. And any questions about this standing meditation there? How did that feel for people?
Kind of felt good. Fine for me. It's like I have that green light response, very much green light response.
Okay.
And that was a big shock because you normally think like the forward punch is, a given where it's like, okay, you shouldn't be doing that. But I find sometimes I'm overcorrecting.
Sure.
Right. And then when I talk to people, I have that power stance, like wide stance, extended out, hips a little forward kind of thing. Because I think I'm in perfect stance that I feel comfortable there, but I didn't know that that was a protective kind of a stance as well too.
Right.
And I find that I'm uncomfortable with my hands to my side. I have to cross my arms in order for my upper body to kind of feel relaxed. I have to like get some sort of like leverage there, some sort of support, if that makes sense.
Very interesting. So I'm hearing you say that you didn't realize that you had this sort of reflexive green light protective response.
Yeah.
And that maybe, this activity in the extensor back half of the body is being counterbalanced a little bit by the crossed arms in the front.
Possibly, yeah. I can cross the arms in the front, and then that relaxes my back.
Right.
Like some tension there, lower border of the right scapula. I have some issue going on back there, so I feel like I have to kind of correct. I feels like sometimes I feel like I'm off balance or I'm off posture or what the
Right.
correct posture is. So I try to do the whole Jenga tower shift.
I like that, the Jenga tower.
Yeah, and then
Yeah.
and then I have a chance to overdo it. So I feel like I'm straight. Everyone says I'm straight, but I'm probably overdoing it. I could relax just a little bit and be in that like optimal range where it's like that yellow light, I guess, if you will.
There you go. There you go. Yeah. Caution. You can go either way, right? Yeah. Yeah. That's right. Yeah. That's really good.
Okay. Yeah, I felt okay. I felt like I was kind of leaning forward on my toes a little bit. I was doing like the Michael Jackson lean kind of.
Right. Right. Sure.
Yeah. I was trying to catch myself there, but it was good. I liked it.
Thanks for sharing that, Andre. Anyone else want to share their experience of what that felt like? Is there anything new or surprising for you as you explored some of those different positions?
Well, I felt the gravity working on me like crazy. The body just felt heavy, and I kept on catching myself from falling forward.
Oh, we can't relax you too much. You'll fall on your face.
Yeah, just heavy, and yeah, lots to think about. If I focus on my toes, then I kind of tighten up on my abs, and then if I relax through my abs and the pelvic floor, then I figured why are my legs so straight? So I have to kind of walk myself through it. I guess it takes practice, I think, too.
It does. Body awareness is not an easy thing, and it changes depending upon a whole bunch of different things, right? How we slept, how we ate, the interactions we're having with other people, responses to emails and traffic and noises and all these kinds of things. So that modulation, that body awareness, to be able to understand where our body is at any given time is really something I think that could be helpful for people who are experiencing pain, because pain is a sign of weakness, and it's bad, and it's something we can't see, we can't quantify. It's very challenging for people, and I think they often feel quite defensive about it. But if we actually allowed them to soften and experience their body and said, whatever you're experiencing is fine, it's your body trying to tell you something. Let's just soften for a minute and pay close attention. Try to figure out if we can affect your body's position in such a way that we soothe it and calm the messages and slow that highway down just a little bit. So Christiane says her ADD kept kicking in and had difficulty staying focused. I know, exactly. Mindfulness is challenging, right? And so I think that often happens for people as well in pain, is that you just don't want to think about their body. Their body has betrayed them and let them down, and it's very complex, and they don't understand it. And they've been trying to stifle symptoms with medications or distractions of one sort or another. So it's not easy to come back and be quiet and focus on ourselves there. Okay. Seneca, thank you for joining us. I'm really glad that you were able to, and hopefully this will give you a little bit of insight in what it's like to work with a really challenging client group. All right, are you ready to try a few things on the floor here? So I've picked a few patterns. These are not from Sarah Warren's videos that were in the blog post that I wrote. What I've decided to do is just go back to where it all began, Thomas Hanna's book. And so it's called Somatics, and there's a lot of different people that kind of used his work to develop some variations of their own. But I thought, let's go back to what he was teaching and his work in the area of movement therapy. So I'd like you to come down onto your back if you're comfortable. And these movements are very small. They're very, very gentle. You may need something under your head if you wish. You may want something under your knees if you know your back is a little bit quirky. And I'm going to be pulling my book up and referring to it as we go. So whenever you transition your body and you're coming from sitting to lying down or standing to sitting, see if you can just take a minute and appreciate that all kinds of organs just had to shift their position. Your brain has shifted. Gravity is now acting on your features in a very different way. So just give yourself a second here. And if you close your eyes, you can have your knees bent and your feet flat on the floor. What I would encourage you to do, if you're warm enough, is to peel your socks off, because, and I'm sorry, I should have done this with you when you were standing. Whenever you can, whenever it's safe to do so, if your clients are in bare feet, it really, really helps your clients to experience their bodies quite differently. And I know many of our clients have probably not seen their bare feet in ages because they just put socks and shoes on right away. So this might be quite something to work on. So with bare feet on the floor, we're just going to start by closing your eyes, and you can relax your a little bit. And just checking in here from head to toe, and you can do this yourself now, just doing a light scan. Relaxing the muscles of your face, your neck and chest, your
And your buds keep cutting out.
Can you still hear me all right?
Yeah.
Okay. I'm going to move a little closer. My AirPods are saying, please replace us. We're tired. We want to be upgraded. So I'll come a little closer. Okay, we're going to start with just a very small pelvic tilt. And so I don't want your back to touch the floor. I don't want your symphysis pubis to end up facing the floor in the front. Can you just use your feet and gently coax your pelvis slightly backward, and then use your feet to gently bring your pelvis forward? So a different way of thinking about moving the pelvis, rather than pressing your back down and lifting it up, can you just kind of draw and press and just relax your back? Just move the pelvis. Now we know the back muscles will be active and the abdominal muscles will be active, but see if you can start the motion in a different place. And I'm going to add a little bit of breathing to this. So you're going to be moving pretty slowly here. So as you gently use your feet to pull your pelvis slightly forward, you can have a gentle in-breath through your nose. When you're ready for an out-breath, then you're going to push your feet gently away from you. When you're ready for an in-breath, you'll pull your pelvis forward to have an in-breath. So your breath determines the speed of your movement. And the movement is really, really tiny. So Hannah recommends that you might do the pelvic tilting about 20 times. And I would encourage you to add the breathing in very, very gently as you do that. And Hannah also coaches that you can increase this range of motion ever so slightly as long as you're feeling safe and comfortable. You don't need to do that, but you can if you're feeling okay with that. And then the next movement is going to be into extension. So bring yourself slowly over onto your belly. I'm going to just face you here. Turn your cheek and put your cheek on your hand. Move your animal out of the way. And when you're when you're facing the one direction, your elbow that's on the floor underneath your head just lifts ever so slightly. So your body is completely relaxed, but your elbow lifts and lowers. And as you're lifting and lowering, notice the muscles around your shoulder blade that are doing that lifting and lowering. And then the next part here is you're going to be lifting your head and looking over your left shoulder. Oh, thanks, Sarah. So you're lifting and looking over your shoulder, and your head comes back down, and you relax completely. And you're lifting a little bit, looking over the shoulder, just doing that a few times. And the last part of this motion is lifting shoulder and head and looking over your shoulder. So you lift your elbow, lift your head, and turn to look over your shoulder and relax back down. So elbow lifts, head lifts, look over your shoulder, and come back down. And for these, each of these are just repeated 3 times. The next part is if you're turning your head in one direction, the leg on the opposite side lifts and lowers 3 times. So you're just lengthening the leg and lifting it out. And then you can predict what comes next. You lift the elbow, lift your head, look over your shoulder, lift your leg, and everything then comes back down to rest. Lift your elbow, lift your head, look over your shoulder, lift your leg. Everything returns back down. And you would try this part 3 times. And then you can go over to the other side. So on the other side, you will, and I'll turn myself around. On the other side, you're repeating that pattern so that you have your other cheek on your hand, and you're just starting with lifting the elbow 3 times. Then you're lifting the head and the elbow. And then you're looking over the shoulder. And you're adding your leg in, so you're relaxing everything. Your leg comes all the way up, stretched out from your hip. And then you're ready to put it all together. So elbow lifts, head lifts, looking over your shoulder, and opposite leg lifts. And then you're coming back down. So elbow lifts, head lifts, looking over your shoulder. And then you come all the way back down. Last time, lifting the elbow, lifting your head, looking over your shoulder, opposite leg lifts, and you're coming back down. And hold on there for just a moment. Let me just see what we're transferring to next. The last part, just to balance out those sides, and I'll just flip here again. You don't need to move from where you are. Is you're bringing both hands underneath your head, turn your forehead down, and now you're just lifting just your head and shoulders. You're not pushing away from the floor. You're just looking up toward the ceiling, lifting your head and coming back down. And if that feels okay, you can push the floor away from you and still look up and come back down. Now, when you're pushing the floor away from you, leave your back relaxed. Let your arms do the work. And then just relax down completely, probably forehead on hands. And just breathing gently. Okay, and then just coming back over onto your back. And just relax down. And I want you to just kind of do a reset here because we did quite a bit in one direction, quite a bit of the other direction. And then kind of that center refocus. And then if you come back onto your back again, you can have your legs straight, or if that's too much tension, you can bend one or both knees. If you have both knees bent, perhaps you experiment by touching your knees together and just letting the weight of your legs fall against each other. Just lengthen a little bit through the back of your head, tucking your chin gently. And just relax into the floor. Here, just go ahead and bend your knees. We're going to combine a bit of flexion, a bit of extension, and use that pelvic tilting motion again. Just going to check the picture. Ah, yes. Okay. So if your shoulders will allow, bring your hands underneath your head and relax your elbows out to the side. Now, in terms of your legs, you can have your knees pressed against or resting against each other. You can have your feet hip width apart, whatever is comfortable for you. And what's going to happen here is remember that very subtle pelvic tilt that you did, and you actually used your feet to pull your pelvis forward your feet to press your pelvis backward. Try that just a couple of times just to remind your body of what that feels like, and very, very small, very gentle. And when you are actually extending your spine and rolling your pelvis into an anterior tilt, tuck your elbows together. Oh, I'm sorry. You're going to leave your elbows out to the side. And then as you press into your feet and drop your spine closer to the floor, you'll actually bring your elbows together. And you can lift your head just a little bit. And the idea is just to lengthen through the back of the neck and just drop your rib cage towards the floor. And then have a nice, slow, small in-breath. Let your pelvis roll away from you. So you're arching your back gently, or you're moving your pelvis, which is causing your back to arch. You're not actively arching your back. And then your breath tells you when it's time to flex again. You touch your elbows together. And then you're coming into pulling the feet toward you, which allows the anterior pelvic tilt again. You're just trying that a few times where your elbows come together, you drop your rib cage, pushing your feet away from you. And then you're pulling your feet toward you, opening up your elbows and dropping your pelvis toward the floor. And from here now, just come back to that bit of a reset position of relaxing your legs however you like. They can come straight. Your arms can come down by your sides. You can tuck your shoulder blades in. Maybe wiggle your toes and wiggle your fingers. And just let your body relax into the floor. One more to show you for the sides of your body. And then depending upon how patient you are, I can show you a very interesting way to think about walking in a standing pattern, but we'll see where we get to. If you bring yourself over onto your side, just going to check my cheat notes here for a moment.
And there's a question in the chat
Sure.
from Taylor. It
Okay.
says, just so I am understanding, these exercises are targeting the green light, red light postures.
Exactly. Yeah. So you're moving away from the defensive postures and becoming more familiar and more comfortable with that neutral posture. Yeah, exactly. So everything is very, very small and very controlled. So this one always gets me. I always have to look at the picture before doing this one. So on your side, relaxing your head on your ear, and everyone can hear me all right still? Okay. So your elbow is on your ear, or sorry, your ear is kind of on your upper arm. You can relax your arm lengthwise along your body. Stack your knees, stack your ankles. And you can come to about roughly 90 degrees at the hips. Doesn't really matter where your knees are. From here, take your top arm, tuck it underneath your ear, and relax your head back down. We're going to work on the long muscles of the waist, but your arm is going to do the work, not your waist muscles. So just like your feet did the work with the pelvic tilting, your arm does the work now to contract or to shorten the muscles of the waist. So you're going to use your arm, picture your elbow here.
Your elbow comes toward your waist, but resist the feeling of the waist relaxing. Relax the weight of your head into your arm. And then the idea behind somatic exercises is always to lower slowly and allow your head weight to be controlled by your arm. So nothing really consciously happens through the waist and you come back down. And as well, the breathing is very much a part of this. So as you can imagine, you inhale as you come down. So have an in-breath here, and as you have an out-breath, head relaxes on your arm and your elbow, your arm kind of lifts up toward the waist, not very high. Make sure your head is heavy, and on your out-breath, you come down. So when you're ready to have another in-breath, we can try one more time. And there's a small pause, of course, between your in-breath and your out-breath, where you're completely relaxed. And then you come all the way back down. So rest here. If you like, you can bring your arm down, have a break. The next part is with your leg. And you're doing that reverse clam idea. And then you're relaxing back down. But you're using the leg weight to slowly lower yourself down to the ground. So you're lifting on your in-breath. And on your out-breath, you're just lowering back down. Rest when you pause in between your breath naturally. And when you're ready again, you lift again. And what you're thinking about is the spinning of your femur in your hip socket. So it winds itself into internal rotation and then it unwinds back to a neutral position. Guess what? Here it comes, both together. Arm tucks underneath your head. So have a nice relaxing in-breath. On your out-breath, you're timing your out-breath now so that you can do very relaxed motion here. And then you're having a nice slow in-breath. Relax your head and your arm all the way down. When you're ready, I've got that, Sarah. It's okay. I got it. And then just continue there and just do a few. Oh, thanks, Mon. So just relaxing as you go through that. Once you've done that a few times, come on over to your other side. And you can roll right where you are. Don't worry, I won't mind if you have your back to the camera. Rest again for a moment because you have to adapt now to all those organs shifting sides and all that fascia getting stretched in a very different way. So you're relaxing on your side once again. And you can have your arm underneath your head here. And the first step again is going to feel very different on this side. Head is very heavy. And you're lowering back down. See how it feels when you combine your breath in there. So you're having a nice in-breath. When you're ready for your out-breath, head is heavy. Your elbow comes up towards your hips, but nothing happens around the hips. They're just pretty quiet. It's not a big lift, and you're just coming back down. And go ahead, we'll try that one more time. So when you're ready for an out-breath, up you come. And then you can relax your arm. And we'll go ahead and try the knee. So knees are stacked one on the other, around 90-ish degrees. And then from here, making sure your head is comfortable. Just think about spinning your femur. You don't have to lift very high. It's going to spin as soon as you lift it, and then it comes back down. And on your out breath, you've got a spin and relaxing for your in breath. And we'll do that one more time. And you don't have to wind it up very far. You're just lifting it. Relax for a moment. When you're ready, we'll put them together. So have a nice gentle in-breath, not very deep. On your out-breath, go ahead and lift at the elbow, heavy head, arm takes the weight, and you're just lifting the leg a little bit and relaxing back down. So it's very different. You're not cranking elbow to hip. Thanks, Shakel. Have a good evening. And then you're lifting once again, elbow coming toward the hip. Your side muscles will shorten and coming back down. On your out breath again. And your in breath, just to relax, to bring you all the way back down. And from here, just relaxing your arm down. Come on onto your back. And Hannah talks a lot about resetting the body and just integrating the movements. So there's always a reorganization time on your back between any movement pattern that you do. So just close your eyes. You might want to do a slight log roll with the leg in and out, maybe wiggles with toes and fingers, maybe a little lengthen through the back of your neck. Relax your chest and your belly. Let your breathing settle from your movement. Let your organs find a new resting place. And just go back to some nice, easy breaths, very light, very gentle, very soft. And then come on up to a stand very slowly. Take your time. Make sure you don't get dizzy. We're just going to do kind of a reorganization in standing and a little bit of an experiment with hip motion. And then we'll just have some discussion. I'm going to see if my headphones have any juice left in them here.
Rejuiced. Okay. You can hear me all right? Okay. So as you come back to standing again, I've got it. There we go. Thanks, Sarah. All right. So as you come to standing, again, just let your body reorganize itself. So here's a reset. Remember to come back into standing, you've got that gentle reorganization of a slight front to back motion. Finding that place where your body weight is a little forward and you don't have a lot of weight on the heel. So the heels aren't lifted, but you certainly don't have all your body weight back there. And then subtle shift to the right, subtle shift to the left. What's your chest doing and your belly doing? Are you still breathing? Are you letting all those organs relax into place? Find a midpoint that's comfortable for you. Relaxing the arms. And now from here, what I'd like you to do is bend a knee and shift your weight right out into your hip joint. So femur, head of your femur is coming right out into the acetabulum to the very edge. Press your legs straight once again and shift sides. Let your body shift all the way into the other hip. And with your breath, super slowly, can you go from side to side? So what I'd suggest is you do an in-breath to come to neutral, an out-breath to shift. And what I'd like you to do is really think about the flow of your body weight up into neutral, bending a knee and allowing the shift to happen to the other side. So what's happening here is your nervous system is not really threatened too much because you're moving slowly and with your breath. And you're exploring pretty interesting joint range of motion here. With a lot of pelvic movement side to side. Okay, now from here, can you think about a rolling motion? So you're still doing the leg straightening and bending, and you have to do, when's the last time you salsa'd? You have to do a hip roll. So can you then bend and straighten the leg and allow this hip roll to happen? So it's quite complex because you have a shift side to side now, but now you've got a walking motion, right? On top of that, and go gently with it. And if you want to feel what happens as you do that, you can kind of trace with your hands. But it's a shift and a roll. And then if you have enough space, the last part of this now is, can you add a step with your shift and your roll? And then can you add a step with your shift and your roll? So you're really exploring a lot of trunk and hip movement. And it just makes you want to speed it up and salsa dance and add some music, I know, but that's the idea. And then I haven't explored this going backward. It's not something that Hannah has kind of in as part of his work, but I thought that going forward was pretty interesting. So there you go, just coming back to a resting position, relaxing your body. And how about we settle down and you give me some feedback about what you just did. So find a comfy spot. And any observations as you went through any of all of those interesting things?
Hey there, how are you?
Good, how's it going? Long time no hear from.
I know it's been ages as ages. I didn't think I'd be able to get in touch, and I watched the first little bit while I was driving and stuck in traffic, but I'm here now.
Oh,
so
nice.
I so
Excellent.
appreciate this class. Thank you.
Yay, you're
I love
welcome.
noticing the asymmetries between the two sides, and that to me was really interesting. And also like ipsilaterally too. So you'd think, okay, I've got issues on, let's say, the left hip moving with the left knee issue. But
Right.
then the changes that are occurring on the right side and getting into those shifts. So it was really interesting and very difficult for me to do it slowly. So I found myself back and forth, back and forth. Okay, no, try this, no. She said slowly. So it was.
And Marianne, Marianne doesn't do anything slowly ever, ever, ever. So to actually say go slowly, and with your left knee issues, long history of that, that could probably feel quite threatening to you. So it's understandable that you just want to get it over with already. And so, yeah, slowing it down would be really hard.
I think that's the interesting component when we're looking at working with clients or with patients. And then I'm looking at this from my own, struggles as well, and taking that advice from you with all of your amazing experience to say, you know what, there is, that little bit of threat or that little bit of, and I like to just push right past it. But I know that emotionally, there are things that are held back that we don't even realize we're holding back. And I think we have to be open to that with our clients as well. So
yeah.
Fantastic.
Yeah, absolutely. Thank you for that. Yeah.
Oh, thank you.
Anyone else have anything interesting? I'm just going to play with pinning the videos here so that I'm not spot lit anymore and we can see all of your lovely faces.
What are your thoughts about the application to this with people who walk with canes? Because they would have more of that red light posture, but maybe not necessarily as in a protective mechanism, but more just mechanically because they have to. Well, they don't have to, but they do adapt to that. So what would you say the application for that would be?
That's really interesting because I would think that to remove the cane would be hugely threatening, which could get them even more into a defensive posture, shortened posture, lower tolerances, lower capacity. So I think that therapeutically, perhaps working on that red light, green light posture awareness, perhaps in supine might be a place to start, where they start to learn what it feels like to find their neutral and understand where their body usually rests, and perhaps they can consider something that it's where they're not quite in one of those threatened reflexive positions. And then perhaps hands on a tabletop or a kitchen counter without the cane, and again that awareness of where do you like to sit in that red light or that green light position. And can you think about that standing meditation? So you're bringing awareness to the imbalances that are just there protectively for them. What do you think of that? Do you think that might be an approach that could work?
Yeah, I definitely think that'll work. The only clinical applicational issue that I would have with that, a lot of my clients have protective mechanisms in lying down. So whether it's on their spine or on their stomachs, anything like that, that's where they'll feel the pain. So I think just introducing those small movements and almost retraining the brain to see that it is okay. It is an okay movement. I think it's very applicable, actually. Thank you.
Oh, you're welcome. Completely agreed. Can you see how that prone exercise that we did, super complex, right? Being in a prone posture is very threatening for a lot of people. And so when you actually put them in prone and then add rotation, I'm not sure about that. So having someone starting in that standing position and having them thinking about where is their body oriented in space, that might be the place to start. And then from there, supine, maybe then side lying, maybe then prone. But that prone exercise, not so easy to do. So depending upon the person, of course, you'd have to be pretty creative, I think.
I had similar thoughts as we were working through these exercises too. I had a hard, well, I would jump between being in my cognitive intellectual brain and being in my experiential moving brain. And wondering, what are the key principles that is being suggested by Thomas Hanna in the somatic work, and how can we just apply those principles in a very creative way with the people that we work with who can't do the prone lying, or maybe doesn't have the range of motion at the shoulder or the wrist, to be able to get into these postures. And I mean, I have his book, and I have to admit, I've only skimmed it. Like, I haven't really done a deep dive, but there was this concept in there that I found so interesting, and it was about what did he call it? Sensory motor amnesia. Yeah. About how we're forgetting how to feel our bodies, and subsequently also how to move our bodies. And so, like, I would love to hear your thoughts, or anyone else in the room, about like, yeah, just like the role of that within how we can pretty much modify any movement that a person looks like they're locked into, meaning like that's the movement pattern that they use all the time, and maybe that's contributing to some of their disability functionally, or also their pain experience. I'm kind of rambling here because I don't have like cohesive thoughts around it. It's just, yeah, as I was working, I was thinking, okay, like, how can I just apply principles from this in a creative way with people, rather than using these exercises as the standard,
Right. And you could see here, Sarah, that I think you'd have to be fairly able-bodied, and you could have pain, but you'd have to be fairly able-bodied. And many of us don't work with people who are that able-bodied, right? They're using external support. They are not able to comfortably move into these positions, and ranges of motion of the shoulder, I mean, forget about it. That's just not something that they are going to be able to achieve. So how might we be creative? Can we think of a way that we could actually move perhaps just the head, and move it in a way where we didn't have to hold on to the weight of the head? And it might just be perhaps, and I'm just off the top of my head here guessing, perhaps supporting the head on different sizes of pillows, to say maybe they just start in a very, very highly supported position, and you gradually move the head closer to the ground so that they're lifting the head further and further. Thanks, Mindy. Yep.
Can I add something?
Sure, of course.
So somatics, from what I get from it, is essentially combining proprioception and interoception. For me, with people who have limited mobility and need that little extra help, I use touch, whether that's with my hands or with kin tape, because it activates neural mechanisms in the skin, and it allows for increased exteroception. So it's basically cueing them to cue the muscles that they have that sensory motor amnesia. So even just placing your hand on their shoulder, most will get a better range than what they would have without it.
That's a great idea. What do you think, Sarah?
Yeah, like that's like, I know, because I have a dual practice where I use manual therapy and movement therapy. So that's certainly something I've worked a lot with, and how touch can help facilitate people's interoceptive ability and exteroceptive ability. And sometimes it can make them too reliant on that touch, and their route to being able to find their body sometimes can be too reliant on these external cues or external tactile senses. And that was a big learning experience for me when the lockdowns have happened, because I wasn't able to practice osteo. I was doing kinesiology primarily virtually. Previously, I would always be like, okay, this is where I want you to feel it and where I want you to move from, and give them a lot of tactile stimulation to help them. And now in the virtual environment, I found that, like, oh, I can't do that. How can I help them find that part of their body that they have sensory motor amnesia? Their proprioception isn't very strong. I picture that part of their body's representation in the homunculus to be like teeny tiny, right? Instead of like robust and all of that. And so, yeah, I think the touch part can be so helpful. And I think sometimes people also need to be able to find a route to that area themselves, right? Where like only having that external cue can actually in the long term be counterproductive. But then sometimes just cueing alone, you can't get there, right? Like a combination of the two, like together, I think would be quite helpful.
Mm-hmm. Yeah, absolutely. I think it's so challenging because we're pretty physical people. That's what attracted us to Kin, to then exploring manual therapies and exploring all of these different tactile techniques. But what about someone who has so much sensory motor amnesia that they're so disconnected, whether that's through emotional trauma, physical trauma, that reconnection has to be so gentle. And then at what point does your influence need to come to an end and they have to start picking up their own ability to feel? And for a lot of people, they don't want to feel, they want to stay up here, and getting them into their bodies is a big challenge. Yeah, so we do have tools. We do have the tactile hands-on move from here, and the taping, of course, helping them to do that when they're on their own, to say, you know, feel that little bit of a stretch in the tape as you're doing this, perhaps. But any other suggestions or feedback for how we can transfer the responsibility of sensory motor stimulation back to one's own body? Especially when a body is, sorry, Sarah.
Oh, you can finish your thought first before I pipe.
Well, essentially when we're working with a lot of people in pain, where they no longer trust their bodies have let them down, their bodies are so aware they perceive that any touch or stimulation externally is just going to aggravate them, and they make their condition worse instead of being soothing and settling and actually helping them to reintegrate again.
The piece I was going to add about having people, like, how can we help people get in touch with their proprioceptive sense? Years ago at a Kin conference, I'm sure some people here were at this conference, there was some research presented about the role of like weighted vests in helping people in their motor control during like a stair climbing task. People who've had an acquired brain injury in a stair climbing task. And they showed a video of this person who would slide the dorsum of their foot on the stair to feel where it was, because they weren't aware of where it was for each step. And then they put on a weighted vest and they were able to just step up the stairs normally, all within like a 5 minute. It wasn't a long-term training effect. It was immediate effect of having the weight on, which the way I understood it was it amplifies the proprioceptive signal. So the brain now has more information to be able to integrate. So that would improve their motor control. And so sometimes I've played with that in movement explorations with people where you want them to be able to feel something, and our instinct is to like give them no weight, have them move against gravity or very lightweight. But as long as their tissue tolerance can tolerate it, I've found it sometimes helpful to actually load them up a little bit more so they could actually feel what's working. And then you can take that weight away and see if they can feel it without the weight. And it's super fascinating. Like some people can't feel it unless it's loaded up. They just aren't aware.
Right.
Mm-hmm.
Yeah, it's like putting someone under a squat bar and all of a sudden their squat just gets incredibly clean, and you think, wait a minute, now you've got like 25 kilos on your back. How the heck did that happen? And they're going, oh my gosh, this feels so good. Whereas before with a broomstick, they're all over the place. So yeah, it makes a lot of sense. Mm-hmm. Thanks for that, Sarah. Any other thoughts?
I would like to ask a question, and maybe it plays on what Megan was saying. When you were explaining, Angela, the red light, green light, you're talking about them as reflexive postures. I should really put this wine down now, shouldn't I? when Andre was mentioning just about his positioning and the arms forward and having that posture, where do we
Ah,
bring in the physiological standpoint of perhaps the, you know, with the tightness in the pectorals or shortening of biceps? When we look at it physiologically, are we saying that this is an adaptation to the physiological changes that are happening and they become reflexive, or where is that delineation?
does anyone want to take a go at that one? That's good.
So to add on to that, I was going to comment on that too. So previously, as I said, I felt that tightness and the tingling in my backside, all gone after doing all that. All gone.
Oh,
Don't feel anything. But I find that it really helps to kind of resettle, go back to neutral as well, to kind of resettle things, so the brain understands that, okay, like that position is safe.
okay.
So it kind of really,
Interesting.
yeah, it kind of really worked that way as well too.
Mhm. Oh, great. Very, very interesting. As we were going through all of that, did you have any thoughts about your reflexive protective positions of that kind of armoring up and as Marion was saying, the shortening of the biceps and the pecs and bringing the arms in front? Was that a way of you feeling more balanced, perhaps physically? Or was it
Fine.
also adding to your need to kind of protect yourself, but at the same time show up in situations that might be new or different?
Um, I would say like this. Let's say I find I'm doing that posturing when I'm talking with my patients.
Okay.
Right. And it's not necessarily like the topic of conversation is kind of confrontational, but it's one of those things where it's like a subconscious like power stance. I'm not trying to say that, hey, I'm in position and over you, but it'd be like if it's a really deep conversation and it shows that I'm actively listening, I get into that kind of stance. I find looking back now. Normally though, what I'm trying to do now, if I cross the arms, it's just more of a comfort thing. It does show that like I'm closed off because it's like normal body language 101. But if I, I'm doing more of the active listening, then they know I'm listening and they kind of ignore. Like if they're reading into my body language, the closed arms aren't really, you know, a sign to slow down the conversation or I'm not interested. If anything, it shows
Mhm.
that I'm more interested. So it's counterintuitive. But in terms of the position, I find like I'm more comfortable that way. Because it's all about where my hips are stationed.
Right.
So about that forward lean. So it's like, you have like the tripod stance with the foot, right? So it's like I have most of my weight more on like the front part of the foot, not necessarily on the heel, and my hips are slightly forward, and I'm more of like extending the back. So the glutes are kind of squeezing away to kind of support me, and I feel really comfortable that way. So if I'm standing there for a long period of time, that's kind of how I do this kind of survive, like standing for 10, 15 minutes straight talking to somebody. A
Mhm.
little bit of I have a little bit of that sway as well to the side lean for weight bearing, but I don't do the front back. Um, and what else was I going to say?
So that's interesting. So you don't necessarily do the front back, but you rest in that front back
In a
position.
way,
So
yeah. So I'm like
yeah,
like the whole Jenga tower situation. It's like I'm using the I guess like Greenland red lights on each side and using that to kind
that's
of
right.
like support each other as I do it. I
Right.
used to stand with my arms behind my back, almost like a karate master or a sensei. They have that arms kind of like crossed like that in the back. And
Mhm.
it was okay, but it's really weird for me to stand straight with my arms to my side and
Mhm.
like normal or anatomical position, kind of like that's super awkward for me. I can't do that. I have to shift somewhere.
That's pretty interesting. Marion, did you have something you wanted to add there?
Well, I was going to ask Andre, is that, or to anyone, is that reflexive or is that compensatory? Because
Right.
if it's a compensatory posture, because it's something that your body wouldn't naturally do or may not be able to get into that, like you said, anatomical position, get into that external rotation, which really isn't, but we feel it's externally rotating in the shoulders to get to that neutral, to get those hips aligned, stop the glutes firing, maybe the hip flexors are over tight, whatever it is. are we compensating for a physiological limitation in range of motion, or even muscles that are just always on and always firing? And is that in fact the reflexive response to that? And do we marry the two, or are they two separate things? And that's where I'm sort of looking for some insight or conversation on.
So I'm just going to jump in here because I actually do very similar things to Andre in terms of like my posture. So, and I was actually just doing it on the ice too. Like I'm very much I will rock side to side, and my arms are usually almost always crossed to the point where my students will make fun of me for it. And like actually one thing that just kind of made me kind of think about my posture is when I was younger, I was actually more pigeon-toed. So, and like I'm still quite like there's a lot of moves that I cannot do in skating because I just cannot rotate externally through my head. Like it's just not happening. I'm not that flexible in that area, and I can still go into that beautiful pigeon-toed, like almost straight line toe to toe with that internal rotation. And I'm like, I never actually put the two together where like, because naturally, if I really don't think about it, sometimes it will have that internal rotation. If like, maybe that's just what is happening in the body of just like, I'm just in like literally everything is just internally rotating toward me. So I actually never thought about that, to be honest with you, but it would make sense in my situation.
Yeah, for sure, for sure. It's so interesting because as skaters, you're pivoting. You need to be able to pivot in both directions and open the body and close the body. Yeah. Thanks, Christiane. Thanks for joining us. So Jess, super interesting that you're observing now that you're coping or you're compensating, or your body is just simply in this state of its own balance, and maybe you being able to explore what would happen if you systematically started to open the body and work on some of these extension rotation patterns, and also that combination of side flexion, internal rotation. So looking at the patterning, mixing up the patterns a little bit more, so that it's a little less thinking about stretching and more thinking and mobility, and thinking more about nervous system reorganization or improving, or moving away from that amnesia sort of situation.
One thing I actually find super interesting about both your cases is like more the psychology aspect of it, that you both said that you couldn't do the opposite movement.
Right.
Do you think that actually plays a role in not being able to do that movement because you're so used to not being able to do that movement? Maybe you're just not concentrating enough on being able to do it or doing it itself.
Pretty mind bending.
Or which movement?
Because you're both so forward shouldered, like upper cross syndrome kind of thing. And you both kind of stated that you just don't feel that you can come back to your neutral, mostly because these are just things that are innate in you, like you've been doing it for so long. Do you find that, or now that you're thinking about it, do you think that maybe in part of that is because you don't think that you can do it? And maybe that's contributing to not being able to?
So I know, like, I can't speak for Andre. I know in my situation, like one of my issues now versus before is like I got 2 shoulder surgeries on the right shoulder, and it's it's like really tightened everything here. So it's just now it's just stuck in this like forward position. So that's just on the right shoulder. So my left shoulder really has no excuse. But prior to the surgeries, I don't know if it was just like how I grew up, because my sister had this issue where her arms grew faster than most of her torso, so, and the rest of her body. So she actually crossed her arms a lot just because from what she told me, just like it felt comfortable and less dangly. And I felt the same way, even though I didn't really have that much of an issue compared to her, but I just felt like when I was growing up, like it was just more comfortable to have my arms in a crossed position as opposed to anything by the side, because it just, I felt very like gangly, like not gangly because I'm not that tall, but it was just like I don't know, it was like my limbs were just like too wiggly or something, just like too away from my body, I guess. And I
Is your
just didn't
sister
really
older
know.
than you? Is
No,
your
my
sister
sister's
older?
younger than me and taller.
Super
So I'm
interesting,
in
actually.
It would be
Thanks,
interesting
Melanie.
to see too, if from an active versus a passive standpoint. So if that hip internal rotation or the, as you said, Jess, the pigeon toed, if it was something from an active standpoint, even neurologically, if you could do it, or if from a passive standpoint, we could get that range of motion through the hips and the shoulder as well. So if the body was actually physically capable of doing it, and then I think that would bring it into that neural aspect to say it's a control issue with the nervous system and bringing you into that positioning.
Thanks,
I would
Karen.
love it if my hips could. I've tried for so many years. My coaches have tried for so many years, and first it just wasn't working, but I would love it because right now a lot of the tension would come like in the knees, and then the knees hurt, and then it's just game over for me. So
So Jess, you mentioned the pigeon-toed thing. So I noticed when people walk, their feet are turned out, the external rotation a little bit at the hip. So I try to teach people to kind of walk with like feet parallel, like train tracks. They got to do a little bit of the internal rotation. So I actually practice, I force myself to walk pigeon-toed to kind of correct and keep my feet kind of at least as parallel as possible. It'd be like, 5 to 10 degree difference if it's a little bit externally rotated, but I try to keep as straight as possible and try to strike from like the very back of the heel to kind of get that rocking chair kind of a deal.
yeah.
It's works good for me. It's a conscious effort. It's mentally draining because you got to literally have to watch every step to make sure you do it right. But once you have that kinesthetic feel, you know if you step correctly or not. When you see someone's wear on the bottom of the shoe, you always use the lateral heel that's like decked off, and then like the middle and then the medial heel is intact, and you're like, okay, well, no wonder this person has all these heel spur issues, knee issues, hip issues if they're not striking straight. Obviously everyone has different tolerances, but I find that like for me, like trying to walk pigeon-toed actually is beneficial for me. I have no limitation in my movement in terms of like what else we were talking about before with the stance and everything. It's just something that like I'm consciously doing because I feel like sometimes my posture isn't straight or isn't ideal posture. So I've been told that like I'm compensating in that green light protection thing because I'm overdoing it, and now my brain registers that like now it's okay, that's my neutral. Now is extension and overextension, so my back's like consistently tight now. I don't know how to neutralize. So it's like we're educating people to kind of get out of their painful and protective spots, and then there's me doing the complete opposite and not knowing what I'm doing.
Isn't
So
that the truth?
yeah, right. Yeah, because we know so much now, so the cognitive brain is taking over because I'm like I'm practicing this and I'm teaching people this because they need it, but I need to kind of practice what I preach, because if I don't do it, they don't see me, and I don't like if I don't do it and I show them how to do it, they're gonna be like, okay, who's this guy? But so I'm overdoing it too much. I have to like back off of it, right? So I have to go more into the red light. But yeah, like
Do as I say, not as I do.
Exactly.
Yeah,
Exactly.
yeah. You gotta do both. Yeah, I gotta say it and I gotta do it, and then they have no choice now.
Right. Oh, exactly. Exactly. So thank you very much, everybody. I think one of the things that we're realizing is that when we have clients who have pain, when we have clients that have this sensory motor amnesia and this disconnect, that perhaps we can think about moving in very, very small movements. So starting perhaps with weight shifting and weight shifting in standing, and then exploring the weight shifting when people are lying down, and the tiny, tiny movements combined with the breath, so that people are reintegrated back into their body a little bit more, and exploring people working with eyes closed so that they can really concentrate and focus on their body And I think as we are able to relax the body into very, very gentle movements, it'll be amazing to see the nervous system actually let go a little bit and allow greater, safer, larger ranges of motion that aren't perceived to be as threatening as perhaps they may have been when we add layers of function and performance on top. So if we take away any expectation of function and performance and just say, just settle in your body for a minute here and just explore what it feels like to breathe in a
time will allow us to go back into accessing bigger ranges of motion again. So I want to thank everyone for joining us. I really enjoyed our chat. And if this is something that you found to be interesting
a bit more, just let me know and we can set up other times to connect and explore different somatic movements, because there's a lot more here that we can play with. And maybe this is a way in of really helping people work in tiny, tiny ways to allow that nervous system to relax and reintegrate and move people beyond their pain. Any other questions or comments before we sign off?
Thank you so much, Angela.
Oh, you're welcome.
I have one. So in regards to just like basic movement, so you know how we were doing the gentle movements. So the ones we typically see, like the hip hinge and you know, the shoulder range of motion, stuff like that. We can still use that, the same principles for desensitization and pain relief as well, right? Like kind of like what we normally do with people who are, you know, perceived with high pain with non-threatening movements. That those principles still apply with those simple movements, right?
I would think so. I think small ranges of motion, staying well away from end ranges, staying well within tissue tolerance as opposed to bumping up against capacity, and closing the eyes and using the breath and really focusing inward. I think if you're able to combine sensation with movement, that would help you.
Okay, definitely. Yeah, those last
go.
three. Yeah, those last three I didn't have in mind at all. Pretty hectic too, and you know, don't have all that time to spend with people to do that. So it's almost you have to do the education first and have them do it at home when you're not running in a busy clinic where you don't really have that space and that noise as well too. If it's too much noise and chaos going around, they can't focus on that. They just feel sensitized. Their you know, the sympathetic is still up. They don't relax, right? So
yeah, very good point.
Yeah.
Yeah.
Even in a busy clinic setting, you can teach them some of these principles, right, and tell them to take them into whatever movement they're doing in their day-to-day life, right? Is to try to move a little bit slower, a little bit more mindfully, paying attention to other parts of the body that are moving that maybe they've been ignoring. Like you can kind of plant the seeds that they can use elsewhere, right? And it doesn't have to be in your session. Mm-hmm.
Definitely. Yeah. That's yeah, I often overlook that. That's where I need to improve on. So that's it's really good to have that in mind, at least front of mind. I got to remind myself every day, at least. So
yeah.
Dr. Sarah Garfunkel is a neuroscientist who talks about interoception and somatics. And she does a TED talk. It's super interesting. You should look into it.
Perfect. I will do that, definitely. Yeah,
Dr. Sarah Garfunkel. It's Sarah and then Garfinkel. She does a TED talk. I believe it's about 45 minutes long, and it talks about interoception and really reintroducing yourself to your own body. And then there is a doctorate of occupational therapy. Her name is Kelly Mailer. She also talks about that. I don't know if you guys listen to podcasts, but Joe Tata, he has a podcast called the Healing Pain Podcast, and he just introduced Kelly Mailer, who's a doctorate of OT, and she talks all about how interoception and somatics help with pain.
Oh, fabulous. Thanks, Megan. That's great.
Not a problem.
Appreciate that. Yeah, cool. All right, everybody. Thank you again for coming out and spending your evening moving around and talking about pain and bodies, which is just our favorite way of geeking out in an evening, really. And thanks so much for your questions and your insight, and hope to do this again with y'all soon. Have a good evening.
Perfect. Bye, guys. Take care.
Bye. Thanks so much, Angela.
You're
Bye.
welcome.
Thank you, everyone.
Thanks, Anne.